Everyone, today I'm going to explain you about the skill development class, that is health education. So coming to here, we are having the topic of determinant of health. Before going to that, what is health actually? So the health is nothing but here multi-dimensional or multifactorial, we can say. Why? Because we will be having good health and also ill health. So when you combine these all factors, so it will depend upon individuals' health and also communities in which they reside. So in this, some of the factors we are having, that is body genetic, which is known as intrinsic. In our body only it is going to happen. External factors is nothing but environmental factors. So these interactions may be health promoting. Sometimes it is also deleterious, we can say. And we are going to modify our health also. So this all is going to include by the determinant factors. Okay, so the determinant factors is nothing but combination of influences like genetics, circumstances and environment, you can say. So generally it is sometimes most difficult to control. Coming to correct definition of determinant of health is nothing but it is a range of personal, social, economic and environmental factors that influence health status. We call it as determinant of health. What we can say here? The personal, social, economic and environmental factors which influence the health status. That when we call it as determinant of health. So this determinant of health mainly based on some categories, some 4 categories, that is social factors, health services, individual behavior, biology and genetics, we can say. Generally these determinants of health are the biological, environmental, behavioral, organizational, political, social factors which will give positive and also negative to the health status of individuals, groups and communities, we can say. It is an interrelationship among these all factors and which will determine the individual and also population health. So by seeing this, let us see the various factors which is included in the determination of health. So here, see here, the determinants of health, the first one, income and social status, social support, employment and working conditions, physical environments, education, healthy child development, biology, genetic endowment, health services, personal health practices and coping skills. So these are the different determinants of the health. Still more we are having the main thing we are going to see here. The first one is biological determinant. So what is biological determinant? The physical and mental traits of every human being. So the behavior of physical and mental, so depending upon the genes and depending upon the movement, we can say it is a biological determinants. And here the genetic makeup, which is unique sense also, is one of the conception, we can say. Here the number of diseases is known to be genetic origin. Example, we can say metabolism, mental retardation, chromosomal anomalies. These are the examples we can see in biological. And nutrition. So coming to nutrition, so we don't have nutrition, certain growth is not going to be there. So and also medical genetics, we are saying medical genetics is nothing but which will prevent and which will be treatment for our diseases, we can say. So we'll be taking better medicines and we'll be living for longer. And a positive health. So here the positive health is advocated by WHO, World Health Organization, which means here person should be able to express completely as the potentialities of his genetic heritage. And next one is behavioral socio-cultural condition determination. It means lifestyle denotes here. Depending upon the lifestyle, we can say here it depends upon social values, attitudes and activities, we can say. And also it is composed of cultural behavior and lifelong personal habits also. Example, we can take alcoholism, smoking, so which has developed through process of socialization And behavioral lifestyle is nothing but here depending upon global urbanization, poverty, low education, stress. This all indicates environmental risk factors. And tobacco use, unhealthy diet, physical inactivity includes behavioral risk factors. High blood pressure, high blood glucose, abnormal serum lipids, high waist hip ratio, abnormal lung function. This all indicates risk factors. And chronic is nothing but heart diseases, stroke, cancer. These all are the examples of the chronic and non-communicable diseases of behavior lifestyle. So generally lifestyles are learned through social interactions. You can say with the parents, peer groups means others, siblings, friends, school, mass media. These are lifestyles we are going to learn. So many current health problems like heart diseases, we are getting obesity, lung cancer, drug addiction. These are associated with our lifestyles. So these are the healthy lifestyle issues. In countries like India, mainly risk of illness, death are connected with sanitation, poor nutrition, personal health, hygiene, elementary human habits, customs, cultural pattern. These are the conditions we are facing in our India. And next factor here is environment. So environment is one of the determinant. Depending upon the climate, water and air, our health will be getting the disturbed. So Patronhofer is a scientist in Germany who had described about the concept of diseases. So generally we are having two types. One is internal and external. Internal environment of man means in our body only, every tissue, organ, symptom, harmonious functioning. So this all depends upon our body due to environment. External or macro environment depends upon the water, air. So because of that we are going to face some diseases. So it is divided into physical, biological and sociological, psychological. So out of which it will affect the health of man and also will become the illness. Coming to micro environment or domestic environment or personal environment, which reflects person's lifestyle, we can say, by eating habits, personal habits. So it also includes occupational environment, socio-economic environment, moral environment also. Socio-economic conditions is nothing but here the health of a person is primarily dependent upon the level of socio-economic development. Example, we can say per capita income. Okay, socio-economic is nothing but here per capita income, GNP, education, nutrition, employment, housing, political system. This all includes the socio-economic. So this is the socio-determinant of health. One is general socio-economic, cultural and environment conditions, living and working conditions, work environment. See here, education, agricultural. So these are the social determinations of the different types we are having. So let us see the next one is economic status. Economic status is nothing but here the per capita GNP. GNP is nothing but gross net rate, I think. Is accepted. It is a measure to calculate our health. So GNP will calculate our health, behaviorals, everything. So coming to here, many countries like mortality. So this all we are facing in our life depending upon family size, quality of life, pattern of diseases. So this all depend upon the community. And coming to education. Education is one of the determinant we are having, that is the which will influence the health of the population, we can say. The world map generally illiteracy closely means poverty, malnutrition, ill health, high infant child mortality rates, and also studies here which indicates that education to some extent affects the poverty of health, availability of health facilities. And next one we are having occupation, and unemployment usually shows a higher instance. For many, loss of work, we can say, loss of income and status, we can say. So jobs, it can also cause psychological social damage. Employed productive work promotes health. And also political system, coming to here, political system is also one of the determinant which is closely related to country. Main important thing of this is health technologies rather than political, we can say. So decisions, depending upon the decisions, manpower policy, choice of technology, health services, so these all are accessible to different segments of the society, we can say. So here the percentage of GNP on health, we are having 3%. And next one is health services. Health services is nothing but here which is important for social and also economic development, we can say. It is a correlation between GNP and also birth of the overall status of the given population, we can say. So use of these services which will promote health and prevent diseases and treat diseases which influences health, we can say, health services. Okay, we'll be having improving the health conditions of the population. So here we will be having PHC, CHC, HSC, other instrumentations also. So here immunization program like AIDS control program, malaria eradication, filaria control prog. So these are the some of the diseases, health diseases we are having. And family welfare programs, other non-communicable diseases also we are having to maintain health status of the population. Next one will be next factor we are having is aging of the population. So here more than 60 billion people age 60 and over, more than 2/3 of them living in developing countries. So here also increased population, chronic diseases, disabilities, we can say. So it requires special attention. So next one we are having gender. So gender is nothing but what here, social characteristics, we can say. The society describes two sexes, one is men and another one is women, which will suffer from different types of diseases at different ages, we can say, in the gender. Okay, so here normally it is influenced by health systems, gender inequalities, income disparities. So this all depends upon the gender. So men health depends upon nutrition, reproductive health, health consequence of violence, aging, lifestyle. So these are all the conditions which is having. So these are the determinants of health policies and interventions, biological, individual, behavior, physical. So these are all interlinked, we can say. Next, other factors we are having here, information and communication technology offers which tremendous opportunities in providing easy and instant access to medical information. So it contributes to worldwide needs of many physicians, health professionals, biomedical scientists, researchers. It is also one of the soul of intersectorial contributions to the health of communities in increasingly recognized. So this is about depending upon age, sex and heredity. So let us see the next question, that is health indicator. So generally here health indicator is nothing but it is a state of complete physical, mental and social well-being, we can say, an absence of disease or infirmity, or health is a resource for everyday life of living, we can say. So coming to indicators of health, indicators is nothing but it is an index or variable which is used to measure our health conditions, situations. Depending upon the situations, how is our health, depending upon community, depending upon our individual population, environment, and we are going to measure the here health. That indicates indicator here means how we will be calculating numbers by using formula. In the same way here, the health, when you are seeing, we'll be having some indicators, some variables, some numbers. So here it will measure the state of health persons, we can say, in a community, and also it is an object and target, we can say. So it is a numerical indication of health. It will give the given population which is derived from a formula. Okay, so it indicates the means, we can say simply, it measures the health of a population. It is having two types, that is mortality indicators, morbidity indicators. And also it will be having list of health indicators. One is mortality, mobility, and also it is having disability rates, nutrition status indicators, environmental indicators, social and mental health indicator we are having. Let us see the motility indicators. Motility indicators is nothing but here which measures the death, occurrence of death in a population during a specific period of time. For example, for a year, how many deaths are there? That one indicates motility. And coming to crude death rate. Crude death rate is nothing but here, it is a ratio of the number of death in 1 year and mid-year population. Mid-year is nothing but in middle of the year, how many deaths we are having in 1 year into 1000 we are going to do. That one it indicates crude death rate generally. So what is the use of this is nothing but here, it will define about the age, sex composition of the population, socio-economic and socio-cultural environment of the communities, we can say. And also expectation of life. Expectation of life is nothing but it is the number of average number of years it is lived by born alive into a population. And current specific mortality rate, we can say it is a statistical abstraction. Specific death rates means it is an average number of years, we can say, which we have born into a population, and current age it will determine the mortality rates actually. So and also it is estimated, it is calculated for both sexes, like gender means male and female. For example, here at birth male will be having 64 years, female it will be having 68 years, we can say. Okay, next one will be having infant mortality rate. Infant mortality rate is nothing but here, it is a ratio of the death under 1 year of age in given year to total number of live birth in the same year. So means what we can say here, generally rate per 1000 live births. Okay, so infants means whole population we have to take socio-economic conditions, how many members are died in 1 year of age which is related to age. Okay, so these are the infant mortality rate. Next, child mortality rate is nothing but age 1 to 4 years, how many deaths are there per 1000 children in the age group. That indicates child mortality rates, malnutrition, low immunization, environmental factors. Okay, so next, maternal mortality rate. Maternal mortality rate is nothing but number of deaths arising during pregnancy or puerperal period, means almost 1 lakh live deaths will be having depending upon the pregnancy woman's reproductive age, we can say. Here this is a specific death rate in mortality rate which is computed for specific diseases, we can say. Almost heart diseases will be getting, that is 25 to 30% of all deaths, we can say. Next we are having morbidity indicators which reveal the burden of all health in a community, we can say. It do not measure the clinical or disease states, it measures the occurrence of diseases in a population. In this again we'll be having different types, that is incidence. Incidence is nothing but what here, number of new cases of a disease which is having tuberculosis. And prevalence indicates the number of all existing cases of diseases, we can say 230 per 10,000, we can say. Point of prevalence, number of all cases whatever new or old, we can say